Well, good morning, everyone. This is Dr. Gerard Cuomo in Boca Raton, Florida. I'm in a private practice, and I do a lot of implants that are very intricate in case design. I work with 2 to 3 periodontal surgeons that seems to be at the top of their game. I want to show you today Ken's case. Ken is a patient of mine, and we're in the process of rebuilding his upper and lower dentition. The case is an immediate load case where you can actually load the case by surgically placing or replacing his existing dentition with that of dental implants. This case was restored with using the Straumann bone level RC implant. So I'm going to walk you through the process of impression taking and a little bit about the preparation of the impression for model pouring in the laboratory. So both dentists and dental laboratory technicians are going to learn my process of what I like to do, and which makes the cases a little more successful for me. So with that, I'm just going to discuss first of all the type of transfer copings that I use. I do have a video out now on how to make these transfer copings. Right now I'm making a few of these, but this is it in a rough form. I'm basically mimicking the peak abutment, and I'll just show you what a polished one looks like. Okay, so transfer copings are made individually. They all are pretty much identical unless I have to modify them further in the mouth. We seat them individually. First of all, I'd like to say, if you can give them to the surgeon, let him put them in place when he takes his immediate impression to send to the lab for the 24-hour fabrication of the fixed prosthesis, temporary prosthesis, which he'll seat the next day. Most surgeons will take the teeth out, place the implants, and then they'll use high collar healing abutments and then make an overnight, usually they'll use Integrity composite to make an overnight fixed prosthesis, just to get them through the first 24 hours. The next day when they come back, the lab will have ready for them the long-term provisional temporary, whether it's screw retained or cementable. It depends on the case. Okay, a little bit about this case. I'm very, very comfortable in placing each one of the modified bone level impression copings and also luting them together in the mouth and making sure that they remain stable throughout the impression process. Here's the open tray that I used in fabricating the impression. I usually will cut out squares and then try the tray in first and then make sure that everything seats, and then I'll have the dental assistant mix the heavy body, and I'll inject the light body certainly, and then what she does is she just takes her finger and wipes away the excess, and so that we can uncover the screw holes. And you got to kind of work. We start to do this immediately right after I seat the tray, and then we uncover each one. She just takes a small little micro brush, gets them ready for me, so that eventually I can go in and unscrew these, pull them out, and then pull it all out of the mouth. Now, what keeps this case very solid and stable is that I've ligated each one of these together using the blue blockout. I'll just turn the light off because this is light sensitive, from Ultradent LC blockout resin, and then I also use diamond burrs. One end is serrated, so it's not going to rotate, and I'll just lute a little bit around this one, a little bit around this one, and lute them all together in the mouth. And where do I place the blue blockout? I'll join it probably right in one of these areas right in here, and then after I do that, I'll ligate each one of the analogs together using the same type of idea. Here you see consecutively the diamond burrs, and once they're all ligated together and joined, and I light cure these, you get minimal shrinkage using the visible light cure material. I'll go ahead and from there, I just continue to give this to the lab and instruct them to go ahead and pour the model. So we end up with a model that's poured, and then from there we're ready to take the bite registration. So this is a model, and if you can imagine this is the gummy portion that fits in here. Okay, so most laboratories will want to pour this first, and this is a mucilage material, a gummy material. This allows them to take this on and off when they want to go ahead and scan these abutments for the computer. Then they slip this in place and they scan the soft tissue. That's not what this video is going to be about. It's just to show you a little bit about impression taking and getting it ready for the laboratory. So this is another case. Actually, this is the lower of Ken's case, and you can see these are all going to be single units. But again, you could, if you wanted to tie these together, on this side it would be alone by itself, to increase the amount of stability in the case, tie it together on the analog side only. Okay, well that's about it from here. This is Dr. Gerry Cuomo. I hope this helps. I'm just trying to give you little pieces at a time to digest, and if you have any questions, feel free to call in. I thought this was kind of neat to show you how we do it here to increase the overall stability of the case and make it work. Dr. Gerry Cuomo, have a nice April 1st. Take care.